Congratulations, you guys have made it to the last chapter dealing with infectious diseases. These etiologies that we're going to discuss in this last lecture are going to be pertaining to the urogenital tract, so urinary and reproductive tracts. And I have highlighted most of the most important issues here. I've highlighted them either in red, or I've underlined them or italicized them, just so that as you are going through these PowerPoints and maybe looking at them later or using them as I'm going through them, hitting the highlights, that it just makes it easier for you to take notes. But again, congratulations. This will be the last one that sort of winds up our semester. I had a little trouble with my voice earlier, so after about 10 days, I'm finally getting my voice back, and it is good to be back with you all. And I'll go ahead and get going with these right now. Again, I want to remind you, if you have your etiology study guide out, this will be really helpful for you, because the ones that I really want you to commit to your knowledge centers, not memorize, but commit to your knowledge centers, are going to be on that particular list. So when we think about the genitourinary tract and its defenses, we have to understand the basic anatomy. So we know with the urinary system we have kidneys. Most people have two, and what their functions are. Those muscular tubes, hollow tubes that connect the kidneys to the bladder are the ureters. Then the bladder is going to be that distensible muscular sac that can hold urine between voids. And then the urethra is this little muscular tube that actually is going to be the conduit between the bladder and the outside. So when we think about a female's urinary system, the urethra is very short. In a male's urinary system, the urethra is much longer. And we understand that the male urinary system has shared structures with their reproductive system, whereas in a female, the urinary system and the reproductive system are totally separate structures. So there are lots of defenses. There's normal flora that's associated with the urethral opening, and we know that urine itself can be acidic and also contain enzymes that help to reduce the risk of potential infections. So these are just some of the built-in protective mechanisms. Again, the male reproductive system has some shared structures along with the urinary system. The prostatic urethra and the penile urethra are going to be parts of that, and some basic anatomy associated with that to review for yourself would be found in these pictures. And I'm going to go through this. Again, these mid-sagittal sections of these systems, male and the female, are great ways to just refresh yourself on the basic anatomy of these systems. So we do have, all kinds of built-in mechanisms to protect us from potential pathogens, including our normal flora. I'm going to go ahead and go through some of these things. Again, if you all want to, for the sake of my voice, but also the length of this lecture, you can go through and read some of these things that I've highlighted that I thought were interesting when I was going through them for you. So again, the normal flora, very protective. If normal flora gets out of balance, then we know this can set people up for opportunistic diseases. And so again, this little list sort of puts everything in a nutshell for you that I've just been talking about. When we think about UTIs, urinary tract infections, that is not very specific. Actually, UTIs are typically of a particular area of the urinary tract. So cystitis would be infection of that urinary bladder. Pyelonephritis is infection of the kidneys. Urethritis, infection of the urethra, and even urethritis, which would be infection of the ureters. So there's also some common terminology that everyone should be familiar with. When somebody has a UTI, it's often associated with signs and symptoms. So painful urination could just be pain even when somebody's not urinating. This is their frequency. They feel like they have this constant frequency. Dysuria, Hematuria, blood should really never be in the urine. It's never a normal finding, so that should not be. There can also sometimes be white blood cells in the urine, and again, that's not a normal finding. Catheter-associated UTIs are ones that we know are leading causes of nosocomial infections. They're one of the most common causes of nosocomial or healthcare-associated infections or catheter-associated UTIs. As far as the most common one, Escherichia coli, E. coli, which is normal flora in the colon. So a lot of times this has just come along because the anus is so close to the urethral opening, and or there's been some sort of contact that has allowed for that to happen. For men, sometimes it's skin flora, so saprophyticus is normal on the skin, so that's the flora that they see in the periurethral opening of the penis, but it can be other gram-negatives as well. Okay. Again, the reason that women are much more common in women than men is because of how short the urethra is, and the bacteria don't have very far to go through the urethra, but also how close it is to the opening of the anus, and women can sometimes really have to deal with recurrent UTIs. So I'm going to go through this. Leptospirosis, I don't even know if I have this one on your etiologies, but just for your information, this is actually a disease, a zoonotic disease that's associated with coming in contact with really rat urine, so urine from other species. So it is caused from a spirochete, a bacterium, and it can cause pretty serious disease, but it really has to have been, somebody has to have been exposed to really those types of conditions. So high levels of really rodent urine. It's one of the more common things that we see that in. So I don't think I had this there, so I'm just going to kind of go over it, or just kind of go by it, if you will. Reproductive diseases that are from microorganisms. Vaginitis, vaginosis may or may not be sexually transmitted. So, oftentimes they actually aren't. Prostatitis is probably not sexually transmitted. With prostatitis, inflammation of that prostate gland in a man. Prostatitis, it's hard to get to that sample. Men don't really want you putting a needle into their prostate gland and getting a sample. So it's very difficult to get samples, and then oftentimes it's from biofilms, so meaning more than one organism might be suspected. So many times they're just treated with broad spectrum antibiotics because it's so difficult to get specimens, and it's usually from more than one particular organism. So in the United States, chlamydia, Trichomonas bacteria, Neisseria gonorrhea bacteria, Treponema pallidum from syphilis, these are at the highest rates ever. So in a recent year, 20 clinics were closed. It's really hard to control, public health diseases when there's not enough public health funding for this. So we have seen, unfortunately, due to decreased funding of CDC, decreased funding in our public health arenas, where we've seen more incidents of these diseases going up that are completely controllable. Some of these sexually transmitted diseases can have a discharge with them. They don't all, because sometimes they're asymptomatic, but some of them do have a discharge kind of disease, and typically it can be a rather distinctive kind of discharge. So if there's any kind of abnormal discharge, it should be checked, it should be cultured, and some of these microorganisms ruled out. Trichomoniasis is caused from Trichomonas Vaginalis, which is a protozoa. Gonorrhea and chlamydia are both bacterial diseases. Oftentimes when someone has a disease that has been sexually transmitted, they usually have more than one. So it really is imperative that people get tested and screened for all of them, not just chlamydia, not just gonorrhea, not just the protozoal trichomonas, but actually for all of the sexually transmitted diseases. So urethritis, inflammation of the urethra. painful urination, yellowish, greenish brown. I've even seen discharge for gonorrhea, the colored discharge. But really, most of them are asymptomatic, so please keep that in mind. If this goes unchecked, it can lead to permanent scarring that could lead to fertility issues. So those are things that you want to be thinking about. Cell pingitis is actually inflammation of the fallopian tubes, and again, the reason that after sexual activity begins, which is normal after sexual activity, that becomes a responsibility to have routine screening. Since most of these organisms many times can be asymptomatic, it means that there should be these routine screenings so you can check them and catch them early to prevent complications like pelvic inflammatory disease and or issues with the urinary tract system or inflammation of fallopian tubes that could lead to permanent fertility issues, because that would not be a good idea. You can see where the uterus is here, the vagina, the uterus, the fallopian tubes, a normal looking fallopian tube, but here's one that where the fallopian tube has become inflamed, infected, and scar tissue is formed, and then the developing blastocyst, which is fertilized egg, right? Blastocyst can't move through the fallopian tube, it gets stuck, and it can actually lead to an ectopic pregnancy. So they can also, something like gonorrhea can occur outside the reproductive system. They can affect the joints. I've seen swollen people come in, athletes come in with swollen joints, and they think it's because of their athletic, injury or whatever. But when we get synovial fluid off of the joint, we realize they have a disseminated gonococcal infection of the joint. It can cause pharyngitis. It can lead to endocarditis. So it can actually be in other places other than the reproductive system. Gonococcal eye infections lead to blindness if they go unchecked, and this is why all infants born in a medical facility in developed countries will get drops of erythromycin in each eye shortly after birth. That takes care of not only gonococcal conjunctivitis from gonorrhea, but also chlamydia, causing chlamydia. So this is a practice that has saved the sight of many, many individuals since that started. This is bacterial, and it can be completely treated and cured. So again, getting good routine screening, but also if any signs or symptoms, going immediately and getting tested and getting treated is so important. And then obviously treating sexual partners as well whenever you're talking about something that is sexually transmitted. You can look at some of the incidences, the prevalence and the incidence of these diseases. That would be just FYI for you if you wanted to, and then how go about also identifying it. Again, that would be FYI. Another, what I just mentioned to you, gonorrhea are frequently co-infected with chlamydia. So when you want to treat these bacterial diseases, you treat them with something that will cover both cases in case they have both of them. Majority of chlamydia trachomatis is asymptomatic. So again, an important thing to keep in mind. That shows you some of the signs and symptoms that males and females may have, but again, you see how many are also asymptomatic. I'll let you just look through those. Chlamydia in infants, if it's found in infants, then again, this eye drops are going to help to prevent blindness from occurring from conjunctivitis, and it can actually lead to more systemic diseases as well. You can look at the pathogenesis of chlamydia and how it actually grows, and how we also go about treating it, and just how important that is. The treatment is not expensive. It's got a really high therapeutic index, so it's not very toxic. It is just, it's just kind of a shame that it goes unchecked, because it is easily treated and easily cured. But certainly all partners would have to be treated at the same time so that you wouldn't get, because you can get a repeat infection if all partners are not being treated at the same time. Vaginitis and vaginosis, when you think about these terms, you'll hear them sometimes used interchangeably. Vaginitis literally would mean inflammation of the vagina. And there typically is going to be signs and symptoms associated with this. It can be caused from a lot of different things that even aren't sexually transmitted, like yeast infections, Candida albicans, which is a yeast infection, or bacterial cause of this. It's called BV, bacterial vaginosis or vaginitis. So anyway, it can be caused from several different things. Again, Candida albicans is what people call a yeast infection. That's the typical one. We also know that, well, it goes through a lot of the Candida albicans. Some women are very prone to that. Gardnerella species, the species is typically vaginalis. Gardnerella is a species that's commonly associated with bacterial vaginosis when the normal flora in the vagina has gotten out of balance for whatever reason. Maybe the person has been on antibiotics for UTI, and so now their vaginal normal flora is disturbed. Hopefully no one douches, because vaginal douching is terrible for women's health overall. You do not want to do that. That disturbs the normal flora tremendously, and so that is never medically advised to do that. Really isn't. It is an unhealthy practice, but for whatever reason, the normal flora has gotten out of balance, and so bacteria, some of these bacteria like the Gardnerella species or Moraxella, can actually get in higher numbers than normal and cause this type of vaginosis. It can cause a malodorous discharge, a little bit of a purulent discharge is referred to as, and so it can be very upsetting for women. It is not typically said to thought that it's sexually transmitted, but sometimes women who have a difficult time getting over it, even after treatments, they will go ahead and treat the person's sexual partner or partners. They'll try to treat them at the same time just to see if that might help with it, but they're really not considered so much a sexually transmitted disease. Even these species, though, can end up ascending into the reproductive organs and leading to pelvic inflammatory disease, which is what PID stands for, pelvic inflammatory disease, which then could lead to potential infertility and or ectopic pregnancy, increases in ectopic pregnancy risk. So anyway, they're not, like I said, not usually considered sexually transmitted, the BVs. The clue cells that you see, just getting some vaginal secretions, putting on a microscope slide, looking at these cells under the microscope, you will end up seeing normal squamous epithelial cells, but then you will also see some that look like glitter cells, and these are called clue cells, and it's diagnostic. That's a diagnostic test. It takes a second to do for vaginal secretions for people with BV, bacterial vaginosis. So and you can look through some of the other things associated with that. There's also a protozoa that is associated with vaginitis. This is Trichomonas Vaginalisis. It's the genus and species name. It's very common. It's called a trick. People say they have trick infection. This will lead to a frothy kind of whitish or greenish discharge, and again, a very malodorous discharge. And it can sometimes be symptomatic, but sometimes not be symptomatic and lead to issues if left unchecked. So again, prostatitis is inflammation of that prostate gland in men. Women don't have a prostate gland, so in men, and it is usually caused by bacteria, but can be multiple bacteria. Multiple bacteria. So this is why oftentimes a broad spectrum antibiotic is given, because it can be difficult to get the specimen, and again can be caused from several different things. Genital ulcer diseases. Syphilis is caused from a bacteria that named Treponema pallidum. The thing about syphilis is that the first primary syphilis, the first stage of the disease, and even secondary syphilis, the second stage, can go undetected. the first stage is usually a painless ulcer where the bacteria, the spirochete entered, and it can be on the hand, it can be in the genitalia, but it can be on the hand, it can be in the mouth. And if it's an area that you don't see, you know, where the sun doesn't shine, then you might miss it because it was painless. It was a painless ulcer. It didn't hurt. The second stage of syphilis can be like flu-like symptoms. And when people have flu-like symptoms, they're not usually thinking, oh, I may have syphilis, a sexually transmitted disease. They're not thinking that. So you can miss that too. So anyway, chancroid disease, soft chancre disease, is actually going to be typically not endemic in this area, but it can be. And then we also have the chancroides Haemophilus ducreyi. I don't think that's on your list. And then herpes, human herpes virus 1, herpes simplex 1, and human herpes virus 2. They are interchangeable, but they can cause some ulcerative lesions that are painful. So those people who have that have the painful lesions, they know they have that because it can be painful. All right, so again, I talked about the syphilis a little bit, and it's marked by these different clinical stages, primary, secondary, and tertiary. You really want to treat it early on because it's completely curable. It's a spirochete, a bacterium that can be treated with antibiotics, but if it is missed, and then years later goes into tertiary syphilis, this can become really a high mortality rate disease and can lead to neurological complications such as dementia. So these go through the highlights of these different phases. Syphilis is actually on the rise right now all across the country, and that's definitely of concern that it is, and that's unfortunate because, again, this is from a bacterial cause and it can be treated, can be cured. It can also be spread to the infant, so this can have huge teratogenic effects to a fetus. And again, something that, in prenatal workups and cares, they should be checking to make sure that the woman doesn't have a latent form of syphilis that can then end up permanently harming a fetus. So the agent is bacteria. It's Treponema pallidum. And what else do I want you to know? I don't know. It's easily diagnosed with a indirect serology test. It's an easy diagnosis, doesn't take long to diagnose it. People should be screened for it because, again, the first and second stages of this are so easily missed. And oftentimes people, if they do have this, then they would want to check for other sexually transmitted diseases because they really may end up having more than one. All right. Again, the diagnosis is fairly easy. It's a indirect serology test looking for antibodies against it. Paul Ehrlich, early on in the early 1900s, it was one of the first to come up with a cure for this because it was devastating to whole civilizations. I mean, we can look back in history and know that some of the more famous people that we know in history actually died from syphilis. This was just such a plague to them. So very early on, salvarsan was one of the first chemotherapeutics. It was really toxic, but people were willing to use toxic medications to try to prevent these dreaded diseases that were so prevalent because there weren't treatments. Chancroid, as I said, Haemophilus ducreyi is a bacterium. It causes what is known as soft chancre disease. This is a painful lesion. You could look up images of this and you'd see that it's pretty painful. It is in the tropics or subtropics, but we are seeing a little bit more of it now because travel is so easy to do these days, and so it does take direct contact, and whatever. So herpes, genital herpes, signs and symptoms. These are going to be vesicles that can be found really anywhere. They can be single or multiple vesicles, and they again can be found anywhere on the body. Most people, and you'll see some of these numbers here. Most people in the first appearance of these, the first time, the primary infection, they're going to have sort of flu-like symptoms along with the vesicles. and then they can have subsequent, because this becomes a latent infection. You never get over this. Some people have lots of recurrences. Some people don't have any recurrences. It's just individual. So some may have recurrent episodes, but again, some people never have them. But they do say an average recurrence of 4 to 5 a year potentially. And then I don't know what else I wanted to tell you about. There isn't a vaccine yet. It's hard to find the vaccines are in testing now, and they're certainly trying to research, since this is probably one of the more common sexually transmitted viruses. And it's thought that, like human herpes 1, which we think of with cold sores, but they're not. We see them in the genital region too, and vice versa. But anyway, it's thought that about 90+% of the population has antibodies against these, so we've been exposed to them at some time or another. So again, they can cause 1 and 2 human herpes simplex virus 1, human herpes simplex virus 2. They're either can affect either region. What else to tell you? Just that they're very common. Stress is, we do know stress can actually lead someone to having recurring outbreaks and or some sort of other insult to the body, injuries, radiation, treatments for other things. So that's where we see that. Worldwide, 4 billion out of the however many billion are infected. So again, pretty common. More common than chlamydia and gonorrhea, which are bacterial. But since it's not reportable, it's just really hard to know. We really do think that most people have had some sort of exposure, and either the cold sores, which are the same, to one or the other of them. So we should avoid contact with areas with people who have obvious outbreaks, but sometimes you're shedding the virus even before there is a vesicle. So before there's any signs and symptoms, you're shedding before that. So this is why they also say that, you shouldn't kiss babies on the mouth. Babies' immune systems are so immature, and they're so immunocompromised that if they were to get the herpes, it may not stay local. It may go into encephalitis, and that becomes a very high mortality rate associated with that in infants. Acyclovir is an antiviral medication that can be given, so that's something that's often given. Now, another virus to think about is human papillomaviruses, and human papillomaviruses cause warts. There are more than 100 different known species of human papillomaviruses. Some of them only will cause warts on like the hands or feet. Some of them can cause warts in the genitalia and other areas of the skin. So there are really many serotypes of human papillomaviruses. A wart is an outgrowth of the tissue, so that's what that is. Condylomas are those things that you can look that up, but those are those branching cauliflower-like masses. It's important to note that most HPV infections are not going to present with warts. So most people who are HPV positive for some of these serotypes have never had a wart or a visible wart. Again, this is why screening is so important when somebody becomes sexually active. An important thing to note is that there are vaccines. There are a couple different kinds. Gardasil is one. I know one of them that y'all probably heard of, but anyway, so there are vaccines for people to get that are recommended by middle school age for boys and girls that can protect against the variants of these that can lead to cancer. So there are several that can lead to cancer, and it's very important that people get immunized. So you see, these are the variants that get screened for. And it would just be really important that people get these immunizations because they can offer protection against this. And it's not that you're really protecting against warts, though that is nobody wants to have a wart, but it's protecting for potential future cancer of the cervix, cancer of the anus, cancer of the mouth and neck and penis. So it's just very important for that immunization because it can protect. Even if someone has been told that they are positive for HPV, which some of them resolve on their own, even if they have been told they've had it, they should still get immunized because you don't know which ones you had. And the immunization protects against multiple ones of them. So it would still be important to be immunized to prevent potential exposure to these viruses that can lead to cancerous changes of these particular tissues. And the CDC says, this is quoting, nearly all sexually active adults will get it sometime in their lives. Again, most people will resolve this infection, just like warts, even skin on the skin and hands will eventually sometimes resolve. Auto-inoculation is possible, so you can just kind of keep them. Screening happens, and it should definitely happen. Vaccinations is so important for this. And then regular screening to look for changes of the cervix so that if there is cancerous changes or what is known, the early changes are called dysplasia, they can be caught early and then they can be treated early for that as well. If there is infection, it's incurable, but when you think about incurable, warts can be removed. They actually have stopped doing that in a lot of cases now. Because, well, just because of the techniques. But anyway, that is HPV. So human papillomaviruses cause warts. Few of the serotypes can lead to cancerous changes. Many of them can be effectively treated with immunizations. So, and the immunizations can protect against them. They can protect against cancerous changes. And then we've already started to see the numbers of cervical deaths with cervical cancer going down with people who have been immunized, and the same thing with throat, oral, neck, and penile cancer. Molluscum Contagiosum is also a virus. It's kind of unclassified, but it's very, very common. And this is in there as genital and sexually transmitted, but it also can be just direct contact transmitted. Children come in with this. So, it can form these skin lesions. It can be transmitted sexually, but also just direct skin contact. All right, in Group B Streptococcus colonization, women who have Group B Streptococcus or Streptococcus agalactiae, women who have it in their vaginas, and it's thought that as much as 40% of women are colonized with it, then they need to, if they become pregnant, they need to take an antibiotic as soon as they go into labor, because one dose of an antibiotic has been shown to reduce the numbers of these so that as the fetus moves through the birth canal, it won't be exposed to this. This is not hurting women. It's not hurting them at all. It's just part of their normal flora. But a fetus moving through can become colonized with this, and then as a neonate, in that first 6 to 12 weeks of birth, this can actually cause meningitis of a neonate. So since this practice of screening women for this late in their gestation, their pregnancy, and then giving them an antibiotic when they first go into labor, this has really reduced the numbers of neonates that we see with Streptococcus meningitis. So that's been a wonderful thing. The last part of this is going to be, where they do a little I like these little last charts where they show the female genitourinary system and the most common things that we think about. And they break them down for the different groups, which would be really important because we know we have to effectively treat. And then they are doing the same thing for the male. So thank you all for your attention. I hope you feel like you've learned something, so learned enough information that it doesn't terrify you that you live in a microbial world, but just that you understand that it is because of these microbes that are protecting us, providing education to our immune system, are protecting us against pathogens, that we get to live lifespans that are, relatively normal, and that we have some respect for the potential pathogens that are out there, and understanding that many of them we can treat, many of them we can prevent from ever happening with immunizations. The world we live in is a completely different world today than the ones before immunizations and chemotherapeutics, effective chemotherapeutics. So I wish you all the best. I hope your education continues. If you've chosen medicine, you've chosen to become a lifelong learner. New things are being discovered all the time, and I'm wishing you all the very best.